Hi everyone, so today we're going to be doing the Eat Well, Move More session, and it's eating out and takeaways for session 11. Now, as a start of every online session, we do the health and conditionings and the added additional resources. So you can see there if you have any health issues, obviously this is online, but please let us know in the lesson. And please scan these QR codes. They should still work and they should have a variety of recipes you can try at home and also online exercises as well. So our weekly goals this week, we're going to be looking at our smarter goals every single week. So looking at our nutritional goals, have we hit our nutritional goals, and any sort of physical activity that we have involved, basically ourselves in this week, and goals that we want to go on for next week as well. So yeah, looking at our specific, measurable, achievable, relevant, time bound, evaluate, and reviewed. So you can see the sort of the circle there and how we can get along with that, um, and how we can go through those sorts of numbers and actually work out what we can actually do with going forward with our goals, etc., and making sure they're realistic. So session objectives today. Likes and dislikes about eating out or getting a takeaway, the calories on menus being displayed, what to watch out for with eating out and takeaways, including salt, adaptations to make takeaways, eating out choices healthier, to discuss ways to cope challenging situations whilst in a social eating setting. So to start off with, I'd like you to pause the video here, okay, and sort of set yourself sort of 5 minutes or so, likes and dislikes about takeaways and eating out. Cool. Hopefully you paused the video and got that done. So we'll go through some of them, but again, I can't do it as I'm not in person with you, but have a little think about what sort of things you like about takeaways, what sort of things you don't. Sort of like if you feel guilty after having it, your sort of behaviours surrounding it. Now, with food hygiene certificate, seen this image before. It's a high food hygiene rating of 5, and it's very good, of course. But I wouldn't go for anything lower than a 3, just because it's going to be unhygienic and it won't be adequate to a standard level. So salt intake. So when we're having takeaways and we're eating out, salt is probably the worst, one of the worst things that come from it, nutritional factors that come from it, because we can't really prevent the salt that they're adding on. We can only just do it at home and actually work it out at home. So that's something that we should consider doing. Okay, so for example, we'll go through them, but fish and chips. If we ask them to put the salt and vinegar on, they might overdo it, and we'll end up having too much of it. So it's not worth having. And asking them having do the fish and chip the salt and vinegar and actually maybe salt it ourselves at home, but we'll go through that a bit later. Recommendations: 6 grams of salt a day, which on average is around a teaspoon per day. Cool. So takeaways. So when we talk about takeaways, very high in calories, salt, fat, and sugar, which are the three no-nos in nutrition. Okay, a lot of saturated fat in them as well, which isn't going to be great, which can lead to different health problems if eaten too often, such as heart disease and type 2 diabetes. So to start with, fish and chips, how can you make this more healthier? We'd be looking at maybe possibly taking the batter off the fish, or if we do like the batter, maybe going half and half. Reducing our portion size would be a massive thing for fish and chips. So we're looking at actually getting a small or medium. They're normally quite big anyway, so that would be something we'd be looking at. We'd be also looking at the sauces, so mayo, etc., garlic mayo, creamier sauces are going to provide us with more fat, and salt as well. Indian, we want to be looking at tomato-based curries, and tomato-based sauces over the creamy ones like a masala or korma. You don't really want to go for the whole shebang, and getting the pakoras, the samosas, the what else is there, naan breads, etc. Kind of pick a couple or half and half. What's your portion size with the rices and the curries as well? With Chinese, you want to also be doing the same. Okay, so watching your portion size. Chinese is very high in salt, so anything that's in sugary sort of sauces, such as battered chicken, for example, is going to be really high in saturated fat. and sugared sauces such as sweet and sour sauces as well. Um, and then also with regard to the veg, trying to stock up on veg would also be really good, and that goes for all of them. If you can get a side salad or a side place of veg, that's going to go also a long way. With Chinese as well, any sort of chicken that's going to be drowned in sauces, sweet and sour sauces, is obviously going to be higher in sugar and salt. So what we want to do is try and decrease that as much as possible, and also watch our portion sizes whilst we're doing it. Kebab we can actually make fairly healthy by going for the grilled chicken or the chicken sheesh, instead of going for what I like to call it mystery meat, which we call the doner meat. And we want to try and avoid that as much as we can, because that's going to be full of salt, full of sugar. Well, not sorry, not sugar, full of salt, full of fat, and it's not going to be good for us at all. And having that with a pita and a side salad and doing our sauce at home, it's actually going to give us some carbohydrates, some vitamins and minerals, and also a decent amount of protein as well. Italian, we'll start off with pasta. So pasta, you just really want to look at your portion sizes, trying to stock up on veg and lean meats, whilst also watching your tomato-based sauces over your creamy ones. So that's going to provide less fat, etc., and also provide less sugar. Pizza side of Italy, you're going to be looking at the lean meats for toppings, not processed meats. Processed meats is going to cause a higher saturated fat, which is going to lead or possibly lead to cholesterol issues. With regard to Italians as well, we want to be looking at portion size. Portion size is going to play a big role. So you need to be looking at that sort of thing. Okay, so can we watch our portion sizes with pizza? So getting a small or medium over a large, it's going to go a long way. Looking at crusts is also going to go a long way. So having an Italian-based crust over a thick crust, or not having stuffed crusts, it's going to go a long way too. Also looking at the sauces, so things like the garlic sauce that comes with it, full of calories, full of sugar, full of salt, full of calories, full of fats, the whole lot. So they're going to be really not great for us. So if we can avoid them and get them at our own pace at home, that's going to go a long way. Now I want you to pause the video here for around 5, maybe 10 minutes, and have a think about everything we've just said and try and apply that to eating out. So we want you to find 5 similarities and 5 differences. Pause that now, please. Cool. So hopefully you've unpaused and you managed to get that done. So we're going to be looking at the portions here, so number of courses, ingredients, calories, other people, drinks, help like balance, limit foods, more fresh and veg, water, and plan in advance. So portions we've already gone over. With takeaways, similar situation. Number of courses obviously plays a role. Okay, so if you do like a starter, for example, just get a main and dessert. So don't get a dessert, just get a starter and a main. If you like a dessert, just get a breakfast and a main, or starter and a main, sorry. And that's going to go a long way. Or if you know you like a bit of everything, half, half, half is also going to do really well. So looking at the portion sizes again comes into play. Ingredients you're not going to be able to think much about, but trying to go for whole ingredients on the menus and looking at calories on the menus will give you some sort of insight into what you're going to be eating. Other people can influence you, so the environment and the people you're around, please be watching that. Try not to be convinced very easily. With some friends that you might have that eat whatever they want and don't put on any weight, etc. Have a little think about it, and that goes on for planning in advance as well. So have a look at the restaurant before, kind of know what you're going to order, and then you can't get influenced by anything. Drinks, for example, full sugared cokes or milkshakes are going to have lots of calories in, and it's not worth drinking your calories away. So it's definitely something to consider with going for diet options, or water is going to be much better. Limiting the food you have is similar to portion size, more fresh fruit and veg. So the more you stock it up with fresh fruit and veg, it's going to give you some fiber options, going to be satiated quite a lot, so you shouldn't be feeling too hungry. And then, of course, hydrating ourselves, which is super important for takeaways and eating out because the salt is very high. So you want to be balancing those electrolyte levels by consuming enough water. Have a look at some menus. Okay, so it says here, as a group, pick a restaurant whose menu you would like to look at with your nutritionist. Okay, that if them plans we spoke about before would also be useful here. Okay, so because this is an online session, I'd like you to pause this for a second and think of your own menu, okay? And then also think of a menu that you know, think of a restaurant you know, have a look at the menu and analyze it yourself based on what we've just spoke about for the last sort of 10 or so minutes there. I'm going to give you 5 minutes to do that, guys, and then come back to the middle. Cool. So hopefully you've got some sort of idea on what takeaways and eating out can do. So I want you to set a weekly goal setting here. Okay. So what you've just done, you've had a look at your menu. Okay. Think about, okay, I know I'm going to get a takeaway on Friday. So my nutritional goal would be plan in advance, see what I'm eating, have a look at the calorie distribution. My physical goal would be making sure I'm satiated and I'm fueled up for my exercise um, for actually performing well. And that could vary for different days of the week. And also nutritional goal, you might not even have a takeaway at all. So it could be avoiding them completely, or if you are doing it, applying what we've just spoke about there well. The next session will be sleep and fluid awareness, which I've recorded as well. So